Rebecca is a 3-year-old female, history of a 34-weeker, requiring a 3-day NICU stay before being discharged home at 35 weeks. She presents today to the urgent care with cough, fever, and increased work of breathing. Mother reports patient began having cough 6 to 7 days ago. Reports worsening cough that seems to be getting more productive over the past 2 days. Mother reports she has been breathing faster and heavier and breathing in at her belly when she's been breathing since yesterday morning. She reports fever for 2 days, Tmax 103. Patient has been having decreased appetite over the past 2 days and hasn't been drinking as well. However, mother has been encouraging fluids, so she feels like she has been getting adequate PO intake. Reports 2 boys so far today. Denies any vomiting or diarrhea. Mother does report the patient will intermittently complain of abdominal pain. Last bowel movement was yesterday, and it was soft. No concerns for constipation. Denies dysuria. Mother has been giving ibuprofen every 6 hours as needed to help control the fever. Last dose was given an hour and a half ago. Mother has also been giving over-the-counter Robitussin cough syrup, but doesn't think it's really been helping. Denies any known ill contacts. Patient does live at home with her parents and younger sibling. She does attend preschool 3 days a week as well. Mother does report that patient does have a history of RSV at 8 months of age. However, she did not require hospitalization for this and denies any other history of wheezing and has never required a bronchodilator. So, as mentioned, mother, as she reported, the patient is a 34-weeker that required a 3-day NICU stay that requires CPAP for 1 day. Mother denies any other prior hospitalizations. For past surgical history, patient does have a history of recurrent otitis media when she was younger and received maringotomy tubes, but mother thinks they may have fallen out since that time. Otherwise, no other surgeries. So patient's vitals and assessments. So patient is 14.8 kilos. Her vital signs upon presentation is heart rate 148, respiratory rate 42, temp 101.9, oxygen saturation 94% on room air, blood pressure 94/68, and patient does report a 2 out of 10 pain on the FACES pain scale, but can't really say where her pain is located. So upon entering the room, upon assessment, patient is alert, however, does not appear feeling well, however, non-toxic. She's sitting on mother's lap, talking quietly with mother with her head laying on mom's shoulder. Her cheeks are a bit flushed, and she does appear to be obviously breathing heavy just upon entering the room. So assessment-wise, eyes, her pupils are equal, round, reactive to light, no conjunctival erythema, injection, or discharge. Her nose, she does have some mild rhinorrhea. Ears are her tympanic membranes, do have mild erythema bilaterally, no loss of landmarks, able to visualize the cone of light. She does have some small scar tissue on her tympanic membranes, which is most likely from her prior maringotomy tubes. However, the tubes are no longer present. Mouth, tongue is midline, slightly dry lips, however, moist mucous membranes. Throat does have mild erythema. Tonsils are 2+ bilaterally with no exudate, no injection, and no oral lesions. She does have full range of motion of her neck. She does have some few mild cervical, some shoddy nodes, mobile without pain, no jugular vein distension. Heart patient, as I mentioned, in her heart rate is 148. She has tachycardic, no murmur. She does have a regular rhythm. Pulses are strong. She does have a nice brisk cap refill of 1 to 2 seconds. She's warm to the touch, pink, and slightly flushed. Lung assessment, she is tachypnic, as mentioned, respiratory rate 42. She does have mild subcostal and supraclavicular retractions. Her cough is loose, harsh, and productive during exam. She doesn't have any cyanosis. Upon listening to her lungs, though, she does have decreased aeration kind of throughout with crackles in the right lung fields, also with few scattered faint expiratory wheezes. No stridor, no inspiratory wheezes, no nasal flaring. Abdomen, she has active bowel sounds, non-distended. She doesn't have any obvious pain with palpation, no splenomegaly, doesn't seem bothered with her abdominal exam. Skin, as mentioned, she's dry and pink. She's a little flushed, but other than that, no rashes. And she does have full range of motion of all of her extremities. So problem list for her past current list, she, as mentioned, is a 34-weeker prematurity. She does have history of recurrent otitis media, requiring maringotomy tubes, and then also her history of RSV at 8 months of age. Current problem list is fever, increased work of breathing, cough, decreased appetite, and then intermittent abdominal pain. Some differential diagnosis for this little girl, of course, viral respiratory illness, pneumonia, pneumothorax, pleural effusion, influenza, and sepsis. So my impression, this again is a 3-year-old female with fever, cough, and increased work of breathing. That the cough's been going on now for almost a week. Upon exam, she did have tachypnea with retractions, and then those vocal crackles in the right lung field. So due to symptoms and clinical findings, my concern is for possible pneumonia versus viral respiratory illness. Patient stats are maintained on room air greater than 90%, as mentioned 94%. She is stable at this time, however, concerns for worsening respiratory distress. So that's what she'll be monitored for. The plan is to obtain an AP and lateral chest x-ray, administer acetaminophen 12 milligrams per kilo to control fever to see if this helps also with tachycardia and just her overall presentation. Due to the few wheezes and with respiratory distress, we'll trial an albuterol nebulizer, nebulized albuterol treatment, 2.5 milligrams for 3 mils, the 0.083%, and see if that helps improve aeration, decrease wheezes, and just helps her respiratory status of it, and then we'll reassess. We'll monitor her oxygen level, her vital signs, and make sure that her oxygen saturations do stay above 92%. And then also encourage fluids to make sure she's going to be able to tolerate fluids and continue to maintain her hydration status. So after the plan, the albuterol neb was completed. Patient is now clear of wheezes and now just with focal crackles to the right lung field. And then the chest x-ray results were also obtained, and findings were right lower lobe pneumonia read, otherwise normal x-ray. So the x-ray findings were consistent with the clinical findings of pneumonia. Patient's vitals have since improved with monitoring after an hour and giving acetaminophen. Her heart rate is now 122, respiratory rate 34, temp 100.4, sats 96% on room air, and blood pressure 94/69. Patient is now drinking fluids, ambulating freely around the room, slightly more talkative with mother. She has very mild subcostal retractions. The wheezing has resolved and still with those vocal crackles. So the plan is this patient can be managed as an outpatient. She will plan to be discharged home with amoxicillin for bacterial pneumonia, 90 milligrams per kilo per day, BID for 7 days. Encourage mother to take and finish all of this medication. And then also due to the improvement with albuterol, we'll plan to discharge the patient home with 90 mics albuterol inhaler. So she can have 2 puffs every 4 hours as needed. And this will just kind of help her get over her pneumonia. Encourage mother to continue to purge fluids, ibuprofen, Tylenol every 6 hours as needed for her fever and pain control, and definitely to follow up with PCP in the next 1 to 2 days. Thank you.